Good evening, middle school parents for Catawba County Schools. I'm Matt Stover, the superintendent, and it is a pleasure to have you with us in this town hall meeting tonight. I'm going to start with a big thank you to our students and our parents and staff. Students, parents, you'd be so proud of them. Our middle schoolers are coming to school. They're wearing their face coverings. They're staying socially distanced. They're washing their hands. And we couldn't be more proud of them. And that is a tribute to you and all your training and wisdom you instilled upon them before you sent them to school this year. So I want to thank you for that. I also know that we'll have some staff members on here tonight who are parents and or just some staff tuning in. And I just want to thank them for all they have done too. And we know as parents, we've seen our students and we have seen our staff do things that we've never had to do before. We've been flexible. We've been just making changes on the fly. And we are just so thankful for our staff and all the hard work they're putting in as well. So tonight, I'm excited. We do have a special guest with us, but before we get there, I want to tell you that this is a really unique time. We are battling this pandemic and trying to educate a large number of students, trying to balance that safety and educational need for our staff and of course our students. And so I will tell you that we know we've had struggles, and I know that you have struggles. So make sure that you understand that I'm not living in reality. This has been a very difficult case for our parents to balance. You've been working, you're trying to get your kids to do their work and try to understand things. When you get home, you're tired. They're still trying to work. Now when they get home, our teachers, they're with their kids. How are they balancing that life and work balance? And so our teachers are trying to work through that and still have time with their family and still be moms and dads as well. So we're in a no-win situation, but I will tell you that seeing your kids in our schools have put a big smile in all of our faces. So thank you for that opportunity. So tonight, a special guest with us is our director for Catawba County Public Health, Ms. Jennifer McCracken. She will go over our COVID-19 updates and processes procedures. I will also hit some state and local decisions, the differences, our virtual learning, face-to-face learning, why are Fridays still virtual learning, balancing that workload. We had a lot of questions about that, state assessments, grading, and sports. And so we had several questions that came in. Thank you for those questions. If I don't hit a particular one of those, we will be answering each one of those in a frequently asked questions that we'll be releasing after these town hall meetings. So that kind of gives the agenda and the outlook. At this time, I will turn it over to a colleague and was becoming my friend as we work together daily. Ms. Jennifer McCracken, I want to thank you and your department for all your help during this pandemic. Your school health nurses have been absolutely wonderful. So Ms. McCracken, if you would, please give them the updates.
Sure. Thank you, Dr. Stover. And just thank you to Catawba County Schools, to the school administration, to your cabinet, to your teachers, and just staff in those school buildings, as well as the students who really are trying to do the right thing. And we certainly are, us as public health and also our school nurses truly see this as a partnership and want to be available to help and assist in any way that we can. And so I want to start out by giving you just a brief overview of where we are in terms of COVID-19 in our county. I'll then move to talking about some trends, and then I'll talk a little bit more about some terms that unfortunately it's becoming common day language, such as isolation and quarantine and exposure and what all that means related to COVID-19. So I'll go ahead and dive in. So as of today, there have been 3,681 laboratory confirmed positive cases of COVID-19 in Catawba County, and we've had 61 deaths so far of COVID-19 in Catawba County, or deaths that are attributed to COVID-19. And so although cases in North Carolina and Catawba County had been on the decline since July, they have now started to slowly tick back up, and as well as hospitalizations as well. And so experts anticipate that the cooler weather kind of brings more people indoors, and that could further contribute to a rise in cases, especially as we move into the winter months. And so I really want to emphasize the fact that right now, the overwhelming majority of cases in schools in Catawba County have been due to outside exposure through family contacts, through gatherings of people, and through community spread. We have not had any clusters identified within any of the schools in Catawba County. And just so you know, clusters are identified as or defined as 5 or more cases in a school that are epidemiologically linked. So it means that we can determine there has been spread between those cases due to being at school. And so we haven't seen those yet. And so that's really good news. So I just wanted to give you, or just walk through some numbers that we've been working with Catawba County schools on a daily basis with, and that's really related to isolation and quarantine. So as of last week, and since Catawba County Schools has returned to in-class instruction, there have been roughly 71 children and 29 staff isolated due to testing positive for COVID-19. There has been an additional 815 children and 110 staff who have been quarantined because they've been close contacts to positive cases. So just to kind of clarify for you, if somebody who has COVID-19, if they are positive for COVID-19, they are isolated. If somebody has been exposed to a positive case, then they're in quarantine. So we'll go through that a little bit in more detail in just a minute. So because of this, we really encourage everybody to really double down in their efforts to practicing the 3 W's: wearing face coverings, washing hands, and waiting 6 feet apart. That's really, really important, especially when you're at gatherings, especially when you're in the community, as not doing so is a major contributor to the current cases that we have in Catawba County. But I did want to talk a little bit about some trends that we're seeing across North Carolina, especially related to school reopenings. So in the weeks since schools have reopened, so thinking about since mid-August to current, the percentage of children with COVID-19 in North Carolina as well as Catawba County, that number has remained steady. We've not seen an increase in the number of school-aged children who have been diagnosed with COVID-19. And that's especially true for that pre-K population and that younger elementary school population. But we've not seen a rise in numbers and in positive cases for that K-12 population. So that's good news. So we did have some questions, multiple questions about where parents can find more information and data related to COVID-19 as it relates locally as well as statewide. So certainly the North Carolina Department of Health and Human Services, they maintain a COVID-19 dashboard. On that dashboard, you can find a whole host of data and resources about North Carolina. And then you can also drill down to a county level as well. You can also find information about clusters that are occurring across North Carolina. So clusters in K through 12 schools. And you can find information about clusters in pre-Ks and childcare centers as well. That's also on the North Carolina Department of Health and Human Services website. You can visit our Catawba County website and find a COVID dashboard that we keep updated on a daily basis. You can find the number of cases. You can find the number of new cases for the day. You can find the number of hospitalizations, the number of deaths, the number of tests that we've conducted, etc. And it's a whole host of information as well as linked to several other helpful resources. So I encourage you to visit those websites to kind of poke around. If you have any questions, you can certainly reach out to Public Health and we'll be more than happy to help you navigate through those. But certainly, I just want to also bring attention to the fact, just once again, that overwhelmingly the majority of cases that we're seeing at school have been due to outside exposure through family contacts, gatherings of people, and community spread. So I think that's a really important point that I want y'all to understand. And the good news is that we do have a number of tools in our toolbox that will help us fight COVID-19 and prevent further spread. So I'm going to talk about a few of those. So first, just so you know, the North Carolina Department of Health and Human Services, along with the Centers for Disease Control, along with the American Academy of Pediatrics, all recommend that students return to school in person, especially those who are in the lower elementary school ages. And the governor, in conjunction with the North Carolina Department of Health and Human Services, have paved a way to make that happen. So one additional resource that I think you would find very helpful if you haven't seen it already is the Strong Schools North Carolina Toolkit. And that focuses on the safety measures for students, for teachers and staff as we come back into the school setting, and really emphasizes social distancing, wearing masks, frequent hand washing, all those prevention measures, and certainly provides a whole host of other information. But it's a great document that I know our schools use every day, our school nurses use every day, and it's packed with a lot of information that's updated on a regular basis. And the toolkit also really serves as a guide as we talk about screening. I know that, when your child first reports to school, that they are screened, their temperature's checked, they're asked a whole host of questions related to symptoms and exposure, and that is required by that Strong School guidance put out by the state. And so certainly that screening is a great kind of first step to ensure that children who may be infected with COVID-19 do not enter the school and potentially infect their peers or teachers. And so it's a tool our nurses use, school staff use, and certainly an important document. But I would be remiss if I didn't make mention of our school nurse team, and they have truly been heroes throughout this whole COVID-19 pandemic. We have always had a robust school nurse team. They certainly are public health experts. They're school nurses who are employed by Catawba County Public Health. They have special training in pediatrics and in adolescent health care. And certainly, as soon as this pandemic started way back earlier in 2020, they worked really just on the front lines in that COVID-19 response from the very beginning. And so they truly are experts. They're not only experts in healthcare and pediatrics and adolescent care, but now you have on the ground experts in COVID-19 each and every day in those school buildings. And they are such a wealth of knowledge and information, and just great, just a great public health connection out into the school. And so we're very blessed as a community to have them. They're just a really strong team. So certainly that is an invaluable tool that we all have that can help us as we navigate through this pandemic response. But we have been getting a lot of questions about symptoms and exposure and isolation and quarantine. So just bear with me. I'm going to walk through what seems to be probably a little bit tedious information, but it's really important as we navigate through this pandemic. So in thinking about symptomatic children and staff, school nurses are working with parents, children, and school staff very quickly to identify students and staff who are exhibiting symptoms of COVID-19. Students who do show symptoms at school are immediately quarantined. We're calling that parent or guardian, we're notifying them, we're talking to them, educating them, and we're recommending that that child sees a medical provider for further evaluation. We certainly recommend that any child who has symptoms be tested. If the child is diagnosed by a medical provider with a different illness, because strep throat, ear infections, none of that stuff goes away. So if they would be diagnosed with a different illness that explains those symptoms, then the child can return to school following those normal school guidelines. And so one thing I wanted to make note of is if you don't have a healthcare provider for your child, or have some type of trouble accessing healthcare, please reach out to your school nurse, because they will be more than happy to help you find a provider who will meet the needs of you and your child. So please give them a call. But moving forward, I wanted to talk a little bit about exposures. And so before I do that, I want to talk about kind of the definition of what exposure could be. So the CDC defines a close contact is anyone who is within 6 feet of an infected person for a cumulative total of 15 minutes, starting from 48 hours before the person began feeling sick until the time the patient was isolated. And so children and staff who we determine who've been exposed to a positive case need to quarantine at home for 14 days after their last date of exposure. Because an incubation period, so a period of time that it takes the virus to grow, is 14 days. So it could take somebody 14 days to develop symptoms. So that's why we have the 14-day period for a quarantine. And so it's really important that the full 14 days pass before the exposed child or staff member returns to school. And so the school nurse will be working with you to help you determine what that 14-day time frame is. So depending on the classroom, depending on the exposure, only a few children might need to be quarantined, or an entire class may have to be quarantined. It really just depends. And so our school nurses are working very closely with teachers, with administrators, to make sure that we understand how children move about in a classroom, who sits near each other, where those children may go throughout the day. And we're really trying to really hone in on and determine who would need to be quarantined. There's a lot of work that goes into that. We don't take that lightly. And so children or staff who are suspected of having COVID-19 are immediately quarantined to prevent potential spread. And then, of course, we're referring those people to a medical provider. And then also for children who we know have been exposed and are quarantined, we recommend that they get tested, especially if they have family members who are also in school or who are in childcare, because we want to make sure that we lessen the spread of disease in those settings. So when we do find a case of COVID-19 in the school setting, so whether it's a staff member or whether it's a student, they are not allowed to come back to school, excuse me, until at least 10 days have passed. And that is because the Center for Disease Control says that people with mild to moderate cases of COVID-19 remain infectious no longer than 10 days. So after that 10-day period, those folks are considered no longer contagious. And so again, the school nurses working with that child and that family to determine what that 10-day time frame is. And so overall, we've noticed that there have been multiple instances where children with COVID-19 are in the same household. We see household contact and household transmission all the time. And so we know that this can impact multiple grades. And we know that it can sometimes have linkages to other schools, and it also can have linkages to area child care centers as well. So again, like I said before, there have been no clusters identified in any school in Catawba County. However, there's always a potential for that. And so we respond to these we'll respond to this on a case-by-case situation in partnership with our state officials, in partnership with school district leadership. And so we'll make the determination on how that's handled. We certainly will work very closely to determine who would need to be quarantined. But just keep in mind, it could be a few students, it could be a classroom, it could be a grade level, or it could be an entire school. We hope it's not that, but certainly, we don't take those kinds of situations lightly, and we do work in partnership with not only the school district, but also our state officials as well. But lastly, I want to leave you with a prevention message. Certainly we've talked about how COVID-19 is spread, and I think most importantly, though, we need to talk about how it's presented. No matter where the setting, we know that those 3 W's that everybody can take will slow the spread of COVID-19. So that's wearing a cloth face covering over your nose and mouth, especially when you can't practice social distancing. It's waiting 6 feet apart and avoiding close contact as much as possible. And washing your hands with soap and water for at least 20 seconds and using hand sanitizer. And we know that both of those are widely available in the schools. And so children have lots of opportunity to do that. And so while none of these measures used alone are 100% effective, they're most effective when they're combined and used together. So with that, I just want to thank you. I want to thank you for all you're doing. I know it's stressful. I'm a parent, So I understand, and I know that it takes all of us working together to slow the spread of COVID-19, and I just appreciate you taking the time this evening and to engage with us about what you can do and how we can better serve you. So thank you.
Well, thank you, Mrs. McCracken. We appreciate you and your leadership, and all our school nurses put in countless hours to help our families and staff navigate this pandemic. So thank you so much. So parents, before I get into this academic portion, I think it's important that we discuss quarantine because I think as parents, we need to know that it is possible that our child becomes quarantined because of exposure. And because of that, you just need to know that we'll have to even be more flexible as if and when more students can come back to middle school and high school, because that is for an abundance of caution. So we don't want this disease to spread, and so to protect everyone. Now, our teachers are prepared for that. That's why we've started Google Classroom or Canvas in your middle schools with your teachers. And they're really doing a great job learning how to make those engaging and very navigable for our students, posting videos, all those good things. But we certainly know that face-to-face is really important. But I don't want to, I'm not scaring anyone, anything like that, but I just think people need to be aware this may be the new normal for some time, that quarantines could be around. And so I think we just need to get as good as we can with it and know that it's definitely a possibility. Certainly, as we think about this too, with K-12 in our schools, they're bigger, our kids are bigger, middle school into high school, our classrooms have not grown. And so social distancing becomes very, very difficult if we do bring back more than half the population at one time. So as we think through that with less social distancing, if and when we have the opportunity, and I'll talk about that in a second, then it does increase those chances. So speaking of Plan A and Plan B, a lot of questions about that from our parents. And again, thank you for those questions. State and local decisions. Our local decisions are made by our Board of Education, our administration here in conjunction with all our staff. We've gotten input from parents and surveys. We've gotten input from our staff. We've gotten, again, we continually talk to our health department officials. And so we are one of 34 districts that started in Plan B, and that came about because of parent surveys and staff surveys and the safety measures that the health department thought that we could make as safe as possible. So we are thankful to have our students at 50%. Now, folks, that's all we're allowed to do right now, 6/12. The governor has not released that, so please note that is not a Catawba County Schools decision. Right now, that is currently a state decision, and we have got to abide by that. So all our guidelines that we get from our health department are in that Strong Schools Lighting the Way document, and we're thankful for those things. And I can't tell you how great of a job your children have done with those 3 W's. We didn't know what to expect coming in this school year, but they've respected it. They've done it. And quite honestly, after they learned how to work with the face coverings, we can see smiles under those faces, and we're thankful for that. So also too, it is our decision for Catawba County that we will continue to offer virtual learning for all students who want to stay 100% remote. Now, that may not be anyone on this particular hangout or town hall meeting, but I think that's important to note, because what we're trying to do, and this has been the challenge since the beginning, folks, and that is trying to balance everyone's needs, whether you want to be all virtual, if you need the kids here all the time, but balance those needs with safety for our students and staff and the educational needs. And so that has been quite the challenge, as you can imagine. Again, I want to thank our Board of Education. They don't take that lightly. We've examined data. We've looked at trends. We continue to look at quarantines. We look at isolations. We continue to get input from our staff, input from you folks. So just know those decisions are not made lightly. All right, so why are Fridays still virtual? So why are these Fridays built in? Well, our teachers, and you may or may not know this, are teaching both online students, 100% students that are all virtual, and our AABB students as well. Now, that is like doing 2 jobs in one, and they're doing that for your kids. They're doing that for us because they love kids, and we're thankful for that. But they have got to have time to plan. They have got to have time to communicate with those children. they have to have time to communicate with you. And so when we looked at our priorities this year, and it's a good time to tell you, is our number one priority is safety and sanitation. Our number two priority is communication. And our number three priority is our culture of our schools, the work environment for our staff and our learning environment for our students. And so when you take that second priority as face-to-face learning is really important for us in communication, then we have got to have time to do that. Our teachers and staff in this district are just like you and me. We work during the day. We have kids at night that we're trying to help get through this. And so our teachers are trying to balance that work life, as I said. So please, that was another question. What about how can I get my teacher to answer me? We do have a 24-hour ask of our teachers. Please note that if it's after 5 o'clock, it may not happen. It might wait until the next day. And I apologize for that, but we have to allow them to be moms and dads as well. And so that's why I thank you for your patience, because we know those kids have questions. We also know that if the kids are at home while you're at work, they may not be as active as we wanted them to be while we were at work. And so now we have to come home and make sure they get their work done. I will tell you that's been our largest challenge, is our students who are face-to-face are doing a great job, but we have so many students on the remote days who are not engaging the way that we need them to, whether it's they don't have supervision at home, whether they don't know how they don't know how to do it, or maybe they're just not telling their parents or guardian what they have to do. And so our teachers and staff are willing to sit down with you and show you how to navigate those learning management systems, the Google Classroom and Canvas, so that you know how to help your children. You don't need to know how to help your children in Math 1 or Spanish or science, 7th grade science. You just need to be able to help them navigate in that learning, in that Canvas or Google Classroom, and then be able to reach the teacher. And then the teacher can help them with that content. And so please, first step, always contact the teacher, because that came up too. What do I do if my kid's struggling? Contact your teacher. In the rare instance that didn't work, contact the principal. But we will certainly get up with you. We have a whole engagement protocol that we're working through to ensure that every student's needs are met, whether it's challenging them or meeting them where they're at because of not being able to learn virtually, because learning virtually is not for every student. It is for some, but not all. So we need those Fridays for our staff, but also too, please note those Fridays are still virtual learning days for our students. So please know that we expect our students to work 4 to 6 hours a day total for school. Now, could that be 6.5 hours one day? It could, because the next day it might be 3.5. But we ask our teachers to plan for 1 hour for each one of their major content areas. And then from a research study that was conducted here in North Carolina at Friday Institute, knowing that if a teacher plans 1 hour, that equates to about 1.5 hours of student work. Now, there's a lot of students on that spectrum. They have a learning disability, are they a great reader, are they maybe a little below grade level on reading, are they outstanding at math, or are they not? All those things take into consideration that balance. So please, if you have a balance issue with your child, please contact your teacher. That was one of our major questions that came in. So, state assessments, that was another big question. Yes, unfortunately or fortunately, if you like state assessments, are on at this point. I will tell you that I'm advocating that those would not be on with our state simply because learning part-time in school and part-time at home is very difficult. The other thing you need to know is I've told our middle school, high school, elementary school teachers that covering the whole content while you don't have the kids all the time and while kids are expected to learn on their own is a very, very difficult challenge. And so we're saying that you need to cover the most important standards that are necessary for that next grade level, because we can't hit them all in that amount of time, and make sure that and so what happens is for a state assessment, they'll come in with these questions on an array of standards. Well, we might not have them prepared for that simply because it is a pandemic. And so that's why I'm advocating against those things, because I feel like although there might be a time and a place, this is not the time nor the place for that. I think we need to leave that to our experts, our teachers, know where our students are, know how to grade them, know how to place them, and our principals do a great job facilitating that. So that's why I'm a big advocate that we don't have any state assessments. Or if we do have state assessments, I'm advocating that those don't mean anything other than for the growth for the next teacher to look at, not to be used to determine this class or that class or wherever we, however we do those things, but only to determine where that next teacher needs to pick up and help that student. So grading was another big question about makeup work and zeros, and so that is so unique to each teacher and principal. I really don't have a good answer for you on that, other than please contact your teacher and work with your principal. They'll work out. This word grace we talk about. If they've missed an assignment, they'll work with you. If you've missed all the assignments, maybe there was an issue, we'll figure something out. We're not here to penalize, we're here to educate. So especially during a pandemic. And certainly our staff is great with grace. If by chance that's not the case, please contact me. We certainly will be graceful for our students and parents as we have shown grace to our staff, and they have shown grace to our students and through this process. So the last big question we have was about sports, and this seems to be a big question across the state as well. I'll do my best to answer this. For high school sports are supposed to start November 1st. Of course, I think I have some questions to that simply because the data is going up. We're still in phase 3. So I'm anxious to hear from our State Athletic Association to hear what's next for that. We are advocating to have middle school sports in this county. We are working with our athletic directors on what that might look like. And I say might because there are some barriers that we're overcoming. If you follow athletics a lot, or if you care, right now, if we would start athletics at the high school level and or middle school level, there are no parents, no spectators. So that means if you don't have any spectators, and that's an athletic association decision, then we have no revenue to come in. Well, we still have to pay referees, we still have to pay the umpires, we still have to pay for travel, which is not a huge expense at middle school, but it's still an expense that our schools are left to handle. So we're working with our schools on how that could be met, so our students still have the opportunity to participate. The other thing is we really need to think about, obviously, the safety aspect of this, and in contact sports, what's that look like? How does that factor into the classroom? So middle school, again, that is our goal, but I can't tell you any more than that because we're really waiting to see what happens with high school athletics. And I think we really need to look at this data to ensure the safety of all our students and coaches to the best of our ability. But we are anticipating having those athletics, and we're hopeful that our data starts moving, trending down. So that kind of wraps it up for sports. I'm about 3 minutes over. I wanna close with this. We have learned a whole bunch during this time. Our teachers have learned so much, our students are learning so much, and parents, you guys I know, have learned so much as well. There's always so much communication coming out. So I would encourage you, if you didn't hear something or you missed something, just call us. I still love the phone much better than an email, I gotta tell you, or a text message. So I've been trying to pass that on with all our staff. A phone call is way better than a email or a text message. So just give us a call. So again, our priorities this year: safety, sanitation, communication, and our school culture with our work and learning environment. And so thank you for your patience with us. And we'll continue to show your grace. I want to say one other thing about attendance, and maybe I did mention this, but folks, don't send your kid to school with any symptoms, and we'll give you grace on that. Send a note in, say my kid was sick, and then take them to a healthcare provider or do what you need to do as a parent. But what I'm saying is just when in doubt, sit them out. We'll get them to work. Our teachers doing a great job with virtual learning. I know it's not as good as face-to-face, but really it's not about me right now or just that one person. It's about our neighbors. So we really need to take in consideration our neighbors and the safety needs of them. So thank you for doing that. And lastly, we're just thankful to have your kids back. Been there, and they're doing a great job. So thank you for your parenting. Thank you for sending them prepared. And we're thankful to be your educational partner. So again, we'll get answers that we didn't maybe hit during this town hall meeting for frequently asked questions later. And at this time, we are going to sign off and sign out. Again, this is Matt Stover from Catawba County Schools, and I thank you for all you guys do for our kids, and I look forward. We got a bright future. Folks, have a good evening.